Good evening, everyone, depending on which part of the world you're in. I thought I can start with a short introduction about myself. I am a partner with Authority Little Middle East, based in Dubai, uh, in consulting for about 15 years, working with clients in the Middle East, Asia, working with providers, payers, regulators on different aspects of strategy, health system transformations, and more on the concept of digitization of health systems. The just in terms of when we start talking about smart hospitals or we start talking about digitization in the health systems, it's always good to step back and look at some of the trends that are driving this radical shift. Uh, Roughly about 7.5 billion population of the world today, likely to increase to about 8.5 billion in the next 10 to 12 years. About 8.5% people above the age of 65, turning to about 12.5% in another 10 years. What it does is it places a significant pressure on the health systems, and that's what we are seeing right now is an increasing part of the economic capabilities of health systems of countries being dedicated towards delivery of care to this aging population, to a population where the chronic diseases are rampant. There is a dramatic shift with increased or a fast evolving therapeutic technologies in shifting from terminal diseases towards more chronic, lifelong diseases. And all of this creates a significant imbalance in the health systems. And this is really where there is an increasing shift towards using technology to drive several factors of change in the health systems. And as these therapeutic technologies expand and the health systems themselves evolve, we're starting to see a number of trends that are coming through. Uh, it's absolutely clear in most health systems that you cannot have a health system which is designed to treat episodic curative requirements, but rather focusing more on how do you keep people out of the hospital, how do you create an environment and a model of lifetime care, preventive care. Uh, on top of that, how do you take care, which is extremely provider centric? Almost all care pathways, almost all forms of health delivery models are designed around the operations of hospitals. So, how do you take that model and turn it around completely to put the patient in the center and then design the operation, the care pathways around that? There's also an increasing realization and an absolute sea of data, which is very, very clear in showing that care provisioning has to move out of the hospital, has to be decentralized, has to move closer to the patient in the community, even to the home. The other thing which digitization or enhancement of the technology in the health system is doing is actually looking at how to make the therapeutic technology, the care itself, from being more invasive to being more visual, more treatment focused, more wellness focused. Uh, a lot of this change is actually being driven by a fundamental shift and in the technology infrastructure landscape itself. I mean, the emergence of 5G, the emergence of fiber networks. What we are seeing right now are health systems that are able to leverage data the way they've never been able to do before. The networks themselves are able to carry a significant amount of data that was practically unprecedented about even 10 years back. Couple that with the whole IoT, the Internet of Everything, the M2M technologies that are coming in, they create a very interesting infrastructure background on which a completely new care delivery model can be constructed. On top of that, if you look at the consumer technologies that are coming through, wireless health technologies, mobility technologies, the health apps, telematics, teleradiology, all of these put together create a very interesting ecosystem and an infrastructure to fundamentally revolutionize the way care is delivered. On the flip side, the patient themselves are getting more and more uh, conscious, more and more informed about their lifestyles, about wellness choices. Uh, with with all the wireless health technologies available, there is an increasing ownership of health amongst the patient themselves. And the health apps, the proliferation of handheld devices, phones, this is all creating an environment where the patient themselves are far better equipped in handling their own health than they have ever been before. All of this technology coupled with the different business models that are starting to emerge in terms of how the payers, how the providers, how the regulators are interacting as care starts to move out of the hospital. There's obviously a different environment that the regulators have to be better equipped to handle. When we start talking about home care, when we start talking about community care, social health, a lot of these topics are creating new paradigms in which the regulators have to step in. The role of the pharmaceutical companies that have predominantly been focused on large uh, bulk drug manufacturing, getting more and more towards personalized medicine, is creating a very different environment in which hospitals, particularly the providers, have to adapt themselves to be able to deliver a completely new model of care. The way when we start talking about smart hospitals, when we start talking about digital health, most of these concepts are starting to look at how hospitals are integrating technology in their business model, in their operating model, to drive three fundamental shifts. One, how do they create a more patient centric, integrated care model that takes the entire care delivery paradigm from an episodic, curative model, delivery model, to more preventive, a wellness oriented care model. And that means care itself, the care delivery itself, is moving outside the boundaries of a hospital, going into the patient's home. So the first trend that we are seeing is more about care delivery moving out of the hospital. The second aspect, where digitization is playing a significant role, where smart hospital concept is creating a huge lever of change in the providers, is how do you then use technology to drive efficiency in operations? How do you lower the cost of care delivery? And the third dimension in which hospitals are using the digital technology infrastructure, the digital infrastructure, is how do you then drive a significantly better clinical outcomes in the care pathways. If we start looking at the first aspects, really about patient centered, about the integrated care models. I mean, there are multitude of examples where hospitals have started to look at deployment of very novel emerging technologies in the way the patients experience care. There are several examples that I can talk about in the Asian health system, in the developing countries' health system, where simply because of lack of access to the hospitals, uh, very innovative delivery models have been created, where the access to care itself has gone through a radical shift. When we start looking at the Asian markets, with a significantly high catchment population per hospital bed, the number of citizens that have to be treated on an average population bed, the lack of the basic medical infrastructure is driving a lot of this innovation. So when we talk about a 1500, 1600 hospital, or 1600 bed hospital that has to cater to a population of a few million, more than a few million, few hundred millions, uh, there is an increasing need for the hospital themselves to evolve and innovate in the way they deliver services. Uh, Most of these technologies are now finding ways or finding root in the way the services are designed. So, how are the clinical services configured? How do you use technology to configure these care pathways? How do you then use that technology to digitize much of the workflows? How do you then use that technology to enhance the patient experience and integrate the patient into the care pathway himself? In the as we start to do these, or as we start to implement a lot of these care pathways, there is an increasing need in the facility itself to become more efficient, to actually separate out the patient, the clinical workflows from a safety perspective, and then using technology, creating, uh, let's say, a differentiated care model where you don't have to use the more expensive, the more resource intensive resources of the hospitals through the entire value chain. And then on the non clinical side, there is an increased utilization of technology towards how do you manage waste, how do you manage material, how do you manage the supply chain of the hospital in a much, much more efficient manner. But when we start to talk about deployment of all this technology in a hospital, it's not so much about looking at just the technology itself. It actually creates an extremely new model of operations in a hospital where four key elements step into play. One, how are the care pathways themselves constructed? So, how do you schedule, how do you design the care delivery model? How can you then take the care and put it outside the hospital in the community using technology? On the flip side, as the patient workflow starts to change, there is an increasing need to drive that patient experience by looking at all the interaction points of the patient with the in the care pathway, and looking at opportunities to either enhance or supplement the patient experience. So, how do you cut down the waiting queues in the hospital? How do you cut down the waiting queues at the billing counter? How do you cut down the waiting queues at the pharmaceutical centers, the pharmacy? And how do you get the patient more and more engaged in taking care of the health in a much better fashion? When we start talking about smart hospitals and we start talking about this patient-centric integrated care model, it's not just about deployment of technology. It's really about rethinking how the hospital itself is structured. How is the hospital's organization, the clinical, the non clinical, the corporate governance, how does it all come together to create an integrated model? And on top of that, how do you then create a completely new generation of staff, clinical and non clinical capabilities in the organization to deliver this service model? And then you bring all that together and you start looking at what kind of incentive models, what kind of performance measurement and performance management model needs to be delivered. And underlying all this is the physical infrastructure, the non clinical, the support operations of the hospital. So, how do you then take the supply chain, the material management, the physical layout of the facility, and integrate this into this new care delivery model? So, in a sense, the smart hospital as a concept is not about creating a new technology infrastructure. It's fundamentally about rethinking the way care is delivered by bringing together the clinical, the, the management, and the physical aspects of care delivery in a completely new model. As we start to do that, there's of course the element of how do you then use all of this technology that gets deployed in the care setting to drive much better clinical outcomes. And there again, as care provisioning starts to move onto a more sophisticated technology enabled platform, it creates a huge capability in the health delivery system, in the hospitals, in the provider capability around how can you use this data to make the therapeutic technologies, the care more personalized. How can you use this technology to drive better and more safe practices in the hospitals? How can you then build this care pathway that is taking care outside the hospital and putting it in the hands of the patients, and then being able to customize that care to adapt itself better to the epidemiology of the population that you're trying to serve? All of this again then comes back to how do you look at data security? How do you look at privacy concerns? How do you create a new model of interaction with the insurance, with the payer organizations? And there are a multitude of examples where we are seeing a lot of this technology starting to take shape in an extremely unprecedented manner. Now, when we start talking about chronic diseases in a more conventional setting, we were looking at technology at two ends of the spectrum, one around the clinical components around more durables, and on the other side, the clinical technology itself. Now, what we are seeing increasingly and is an integrated, a full spectrum technology framework where the monitoring and the clinical parts are coming together and creating a closed group management of the entire chronic disease management. For example, I recently was working with a manufacturer of portable insulin pumps in China, which allows the uh, uh, which allows the insulin pump to be actually put on the body, which not only monitors the glucose levels but is actually able to then feed through a SIM card, brings the patient's information onto a closed group system, and allows the hospital to monitor the health conditions, uh, the vitals of the patient 24 by 7, and then is able to prescribe not just the medication requirement but an overall wellness program for the patient based on this system. Now, the technology itself, while becoming more and more mainstream, is not just the core. It's really the service model itself that is starting to evolve around this and is then integrated into the service model of the hospital. That's unique. However, when we start to talk about a lot of these technologies, these are not without challenges, right? Particularly in the context of a health system, there are several challenges that still need to be addressed: redundancies of the systems, reliability of the systems. But it's not so much about the technology, it's about the organizational capability that hospitals need to build up to be able to handle this technology, to be able to handle this new model of care. Also, as therapeutic technologies start to change, there is a need for these systems to be more modular and these systems to be more adaptable for the care system to evolve over a period of time. And as this technology starts to integrate itself in the hospital, the training, the capability development of people involved in the usage and in the deployment of this technology has to be continuously adapted. And on the other side, I think the last two challenges are really about how do you make this whole technology system more secure? How do you handle data privacy requirements in an increasingly open world? Uh, One of the key challenges, and the last one I would talk about, but probably the most important one, is how do you actually bring the clinicians integrated into this overall paradigm of service delivery? And that's really where most of the changes have to focus on. So when we start talking about smart hospitals, we start to look at the smart hospital concept, we start to look at the agenda of a smart hospital, not necessarily as an approach towards deploying technology. It's really about creating a completely new model in which hospitals or providers have to deliver their services. So at the top, it's really about how do you deliver excellence in the overall concept of health delivery. How do you make the care delivery model more patient centric, more integrated, and how do you make it extremely efficient? But to do that, what you really need to look at are the services, the patient centric services, the interfaces, the care pathways, the care processes, and how they get orchestrated across the traditional departments in a hospital. Supporting that is the entire supply chain, the logistics, the support services organization design. And then below that is the organizational capability. The organizational capability, the new paradigm of clinicians, of support staff that has to be capable of handling this new care model. So, all in all, when we start talking about a smart hospital, it's really about integrating these four components that has to come together, which has to sit on a completely new way of looking at the medtech infrastructure. And using that medtech infrastructure, how do you fundamentally redesign the facility itself, the layout, and facilitate the care pathways, the IT infrastructure, the operations, and how you manage the overall concept of information in the hospital. So, when we start talking about smart hospitals, setting a smart hospital agenda, it's really looking at the overall picture of how this whole model gets integrated in a hospital and not just the technology that comes to play. This is what I had to share. Uh, Thomas, if there's any other discussion, I'm happy to take questions if you have.